may complain that going back to school is a real headache, but for many children, that's not just an expression. New research shows emergency room visits for headaches increase in the fall as kids head back to school. Joining us this morning from Gundersen Health System in La Crosse, Dr. John Peter Temple. Thanks for joining us, Dr. Temple.
Good morning.
Are we seeing this trend of increased headaches in the fall here in La Crosse? Do you know?
We generally do, and there are a number of reasons why that happens.
What are some of those reasons?
Well, with the onset of school within the next few weeks, we see a bump in our calls and visits for headaches, and there are a lot of things that go behind that. First of all, it's a change in the sleep schedule from your summer schedule to the fall schedule for school. There's a change in eating habits and hydration. There's a change in the stress level. Many children who are entering school find it as a very stressful time, and that tends to bring out headaches quite a bit.
What are some easy treatments, if there are any, that you can do at home, or when should we sort of contact a doctor when these headaches are getting really bad?
Well, I would suggest that parents really work hard to get their children back to their school year routine as quickly as possible. And that largely relates to eating 3 healthy meals per day with a protein source at each meal, to keep hydrated, usually between 64 and 84 ounces of fluid per day, avoid caffeine, and perhaps most importantly, that they get into their normal sleep routine with a regular bedtime and a regular rising time without too much variance on either end.
Okay, yeah, getting into that routine can be especially hard, and it has other effects, maybe mood or temperament, but it could actually affect their stress and then give these kids headaches, is what you're saying.
Yes, that's definitely the case. And many headaches can be treated simply as long as it's not overdone. For example, acetaminophen or ibuprofen used intermittently can go a long way to helping headaches. But when those efforts are insufficient, or a child is needing more than 3 doses of those kinds of medicines per week, then generally they need to be seen by a physician to talk about further measures, things that can be done to help that child.
So constant headaches, if they're having them daily or multiple times a week, then it's sort of time to maybe take the next step and get into your doctor and seek some help.
That's true. And the reason is that this will affect their school performance.
Yes.
And the last thing a family would want to do is to have their child start the school year off on the wrong foot.
Right. Very well said. Thank you, Dr. Temple. That's all the time we have this morning. Thanks for joining us.